to work, do you have access to private transportation? Can you ride your own car? Can you sanitize it as you get in and get out? I'm still going out and shopping maybe once a week. When I do, I bring the Purell or the Lysol with me, and as soon as I get back in the car, I take the gloves off and I sanitize my hands, my wheel, my keys, everything I think I've come in contact with. Um, and of course, I'm getting into my car, right? I'm not getting on a subway. I'm not getting on a bus. I'm not forced in order to gain access to what I need in the world to come in contact with a large number of anonymous others who may be transmitting the virus. Whereas if we think about those Americans who have to go to work because they can't afford not to, many of them also can't afford private transportation, and so they're forced to take public transportation, and so they're at much greater risk. I'm going to talk next about technology. We are all right now communicating via our computers or phones, right? And that means, among other things, we have computers and phones, and presumably we have internet, Wi-Fi, or at least cellular access. And if you have that, and if your kind of work is information-based work, if I'm just doing research and sharing it with you, then that's something I can do from home. We may not like it as much, right? It might be much better to be in the sky room actually seeing each other's faces and talking with each other and interacting with each other directly, but at least we can do this. But if you don't have a computer, if you don't have a cell phone, if you don't have Wi-Fi, how are you going to do that? Or if your job is delivering boxes to people's homes or packing those boxes, you can't do that from home, right? And similarly, with the fact that almost every school in the United States has dispersed and moved over to online education, that means that literally millions of children are not gaining access to education right now because they don't have the computer, they don't have the technology, they don't have the Wi-Fi. I don't know if you saw this story about the children in Arizona, I think it was Phoenix, that the principal found huddled under a blanket right outside of the school. And he said, "What are you doing?" And they said, "Well, we don't have Wi-Fi at home. We're trying to do our homework. We need Wi-Fi." Right? And so they went to the school, or they're going to the Starbucks, but the Starbucks is closed, so they're right huddling outside Starbucks, and Starbucks is trying to disperse them because they don't want the density of people. Obviously, our digital divide is also affecting our access to work, our access to education, our access to health and safety at the moment. There are also environmental inequalities. And I think one of the really striking findings in the research I've been doing is that the mortality rates are much higher in areas that have higher levels of air pollution, or lower levels of air quality. And I want to be careful here. In social science, we say correlation does not equal causation, right? And so some of the factors that I've been talking about, concentrated poverty, density, multi-generational housing, need to go out and work, coincides with poor air quality. But it does appear that this may be an independent variable, right? Just the fact that your lungs are less healthy because the air that you breathe is less healthy may be contributing to higher fatality rates in people who are forced to live in neighborhoods with greater environmental risk. And then for those of us who are lucky enough to not be under shelter-in-place orders, who are still able to go outside, do we have access to parks? Do we have access to areas that are not congested with people? This also is going to make a difference in terms of our ability to maintain our health. When it comes to talking about inequality, we also, in this country, always have to talk about race. And I'm going to talk about generation and geography as well when we get later into the lecture. But you've seen the striking data. I'm going to focus on Michigan because it's an easy example. In Michigan, African Americans are 14% of the population, but 40% of the COVID-19 deaths, right? So they're dying at nearly 3 times the rate of their proportion in the population. And this reflects the fact that they have to work because they don't have savings. They work in areas or ways that involve having to be in contact with other people. They have to take public transportation to get there. Everything that we're talking about is amplified when it comes to racial inequality in America. Now, I want to say one last thing about this, and this refers to the coronavirus's impact on economic inequality. And we know perhaps more Americans rendered unemployed in the last month than at any time since the Great Depression. A very slow governmental response, and so far inadequate. You've probably seen that in many European societies, the government is simply stepping in and guaranteeing and paying the wages of workers who are no longer able to work because their workplace is closed, right? Whereas in the United States, we've taken this much more indirect path of giving Small Business Administration grants to the owners of small businesses, and that's been gummed up badly in the banks and in the government to the point where very few small business owners are actually getting these loans yet. And so they are furloughing and laying off employees. And I'm going to talk more as we get further into this lecture series. There's a distinction between benign and malign causes of equalization, right? Good and bad forces that tend to produce less inequality in the distribution of income and wealth. And one of the malign, one of the bad, one of the destructive causes of greater equality historically has been disease. And so there's some sense that the disease may in fact do more damage to the wealth of the wealthy. But I'm not convinced that that's going to be the case with this. We'll have to see. But I want to point you to a diagram I've shared with you before, just for a moment to think about how complicated this may be. This is a diagram that shows price changes over a roughly, I'm having trouble seeing it all because I'm covered up partly. Yeah, roughly 20-year period. So if somebody can just nod or thumbs up, do you see it when I move my cursor around on your screen? Good, okay, I'm glad. So I know I've shown this with you before, but this is a slightly different context to be thinking about this in. What this diagram shows is that goods that have not been globalized, right, that have not been outsourced to other countries, that can't be, like college or hospital services or childcare or housing, right? If you want all that stuff, doesn't do you much good to purchase it in China or Brazil unless you want to live or get your education or get your medical care in China or Brazil. But things that can be outsourced and manufactured using a global supply chain have become either more affordable or at least not less affordable over the last 20 years. Now, the virus, the pandemic is global, right? That's the very meaning of pandemic. And it is disrupting global supply chains. And it occurs to me that one of the outcomes of this pandemic may be that our access to the cheaper stuff that in a sense has allowed people whose income is stagnant to nevertheless, in certain respects, maintain their standard of living, or maybe even better their standard of living. That's going to be more difficult if one of the effects of the pandemic is to partially disintegrate the global economy for the next year or two while it moves society to society at different rates, and societies become much less willing to let persons and perhaps also goods move across the country freely. The last thing I want to say is, as an overview about this, and I'll again get into this further as we go into the course, has to do with unequal access to healthcare in the United States. And again, this is something that I think we are aware of, right? Who has health insurance, right? People who earn $20,000 a year or less, 1 in 5 of them don't have health insurance. And by the way, these are the people who qualify for Medi-Cal, Medicaid, right, public assistance with their health insurance, which is probably the only reason that it's not even a higher percentage. And the reason why, if you look, it actually doesn't make that big of a difference at all. If you're making 20,000 to 40,000, it's a similar percentage share with that health insurance. But if you're making $40,000 a year or more, it's less than half as likely that you're going to not have health insurance. It's fewer than 10% of the population. And something is true, similar is true with regards to education, right? If you don't have a high school education, 30% chance that you don't have health insurance. If you're working, the kind of job that you have doesn't provide it. If you graduate from college, that goes down to 5%, right? And so that's a substantial shift. In terms of what's happening with the healthcare system in the United States, and I spoke with those of you who were able to hear me last week about the differences country by country, right? Germany and Norway and Australia and South Korea have done a much better job than the United States at managing the coronavirus. And I think when you look at what's happening with healthcare in the United States in general, what you see is that the coronavirus is exposing the fact that our healthcare system was already broken, right? And so this is life expectancy at birth, and you can see that it's been going up for almost every country in the developed world. It's been going up steeply for China over the last decade. But in the United States over the last decade, it has stagnated and then actually declined. And this isn't exclusively about our healthcare system. I will talk with you later in this lecture series about the opioid crisis, about alcohol abuse, about heart disease associated with high levels of economic stress. So-called deaths of despair are part of the reason that the United States is actually moving backwards in terms of life expectancy, while every other society of comparable wealth is moving ahead. And please note, right, this is the first time in American history that life expectancy has stagnated or actually declined. But it does also reflect how many Americans don't have health insurance and how inadequate the health insurance that we have is, the high deductibilities, and then the difficult choices people are making where doctors prescribe them a medication, but they don't actually take it because they can't afford it. I definitely think that this is part of the explanation as well. And so this is then, I think, the most striking illustration of the intersection of inequality and health outcomes. And what you see here, and I know it may be a little bit hard to make out. But this top portion of the diagram is for men. This bottom portion of the diagram is for women. The gray dot is for people born in 1930. The yellow dot is for people born in 1960, and then it's life expectancy. And what you can see is that for people who have, and the population is divided into quintiles, 20% groups. For people who have the lowest income, their life expectancy, if they were born in 1930, was higher than if they were born in 1960. And then for everyone else, their life expectancy is greater, but the richer that you get, the greater the gain in life expectancy. And there's one other way to look at this data, which is about inequality in life expectancy. So if you connect the gray dots, what you see is that the difference between the poorest and the richest was not too great if you were born in 1930. It's a difference of only about 5 years. But if you're born in 1960, that difference, right, you've got to follow the yellow dots now, between the lowest income and the highest income is coming up on 15 years for men. And you see something similar, but even more pronounced for women. Look at the divide for women, and it moves backwards in the first two cat income quintiles, stays the same in the middle, and even backwards for high income women. It's only the highest income women who've really seen their life expectancy go up over that 30-year period. And so again, if you look at the inequalities were really not very sharp at all for people born in 1930, and they're staggering for people born in 1960. So that's my overview of the reasons to be thinking about inequality now. And one of the things I didn't like about my previous lecture was that I talked and talked and talked and didn't pause until the end. I'm going to pause now and so give you all an opportunity to ask whatever questions you might have about the motivation for talking about this topic at this moment. So I think you're unmuted now, just so you're aware. What you say will be broadcast to the group.
Do I press the chat button? Who's talking?
So I thought I might have heard Flossie saying she was pushing the chat button. Did I get that right?
Yes, can I speak?
Please speak. That would be much more efficient, I think.
I understand perfectly why you're asking us to see that this inequality didn't begin yesterday.
Yeah.
It began a long time ago, because our African American people have been taking, may I say, the shit for a long time. It didn't begin a month ago. Yes, they're overcrowded. They eat lousy food because it's the easiest thing to get hold of. And I think some of us have been blind to that, or you've just taken for granted that this is the way the thing is. And it isn't going to be that way anymore. Whether Trump makes it or doesn't, if he makes it, we have a revolution. The other thing that I wanted to say, those of us who were born in the 30s or a little bit before developed an immunity that we never thought we were developing. We survived, many of us, not only measles and chicken pox and mumps. We survived rheumatic fever. We survived streptococcus infections. We also survived the Asian flu.
He also had better
And
eating.
I think that has left us, even though we have done nothing to deserve it, we just survived. And so we have a certain degree of immunity that people who were born later might not have. I just want to not congratulate us, but possibly explain why some of us are still around.
Yeah, you're tough.
Kind of tough, even if we're crippled. All right, those two things. Thank you, and good to see you.
Good to see you. Oh, I'm not actually seeing you, Flossie, but good to hear your voice. I'm glad I recognized it. I got it right.
That's
So let me respond to those points in turn. And so on the first one, yes, our inequality is stubborn and old, like many of the rest of us, right? And on the other hand, I want to be clear here. If we're talking about racial inequality, yes, in certain respects, politically, in terms of civil rights, political rights, it's gotten better since the 1950s, markedly better. In terms of economic inequality in ways that we'll get into, there's a genuine African-American middle class now. That didn't exist 70 years ago, or it was so tiny as to be statistically insignificant. And yet the black-white income gap is stubborn. It really hasn't gone away. And in many respects, although I think most African Americans would rather live in Queens or Detroit than in Jim Crow, Mississippi, and they voted with their feet on that issue, they are still segregated. We are still a segregated society. And one of the things I will be talking about as we get further into this lecture series is the fact that in a sense, we have replaced aspects of legally enforced racial inequality with geographically based racial inequality. But it's not just racial. The geographic dimension of inequality extends to white Americans, it extends to Latino Americans, it extends to Asian Americans. It is, in a sense, one of the new keys to inequality. A lot of sociologists will say, tell me somebody's zip code, and I can tell you most of the relevant social profile, right? Now, Flossie, you concluded this by saying, even if Trump is reelected, there's going to be a revolution. I wish I had your confidence. I will note that one of the things that happened in the week since we spoke is that Bernie Sanders dropped out of the presidential race. And I don't know about you. I'm old enough and experienced enough that I'm not completely taken aback by that development. I've had many candidates that I support drop out or not get elected. But my students are really crushed by this. And so I want to say just a couple things about this for a moment, because I think it's relevant to what we're talking about. One of them is that Bernie Sanders represented what you might call an alternative vision of society, right? A vision in which healthcare was a universal right, and a vision in which public education was universally available to all the way through college, right? A more egalitarian, a more solidaristic, a more we're all in this together vision. And that's was, I think, for many people, hopeful, encouraging, that voice was getting public attention, and not just public attention, a substantial share of the support from the Democratic electorate in the primaries, right? And so when Bernie Sanders drops out, that means that perhaps we return a little bit more to the normal range of American political options, which doesn't seem to give us much of an option to address our inequality going forward. And so I think one of the implicit jumping off questions for this lecture series is, how much will the coronavirus change us politically? Will it perhaps remind us how important functional government is, and also perhaps why it is that we need a government that is actively looking after the economic security of the average person in our society. The other thing about Bernie Sanders dropping out is he was the anti-plutocratic candidate, right? He was the one who said, I'm not going to take big donations. I'm not going to have fundraisers. I'm going to do this all with small contributions, right? And the average size of the contribution Bernie Sanders received was $18. And he received millions of them, right? And so the idea that a candidate without a great deal of wealth, either himself or behind him, could possibly politically succeed was another, I think, refreshing aspect of Bernie Sanders' campaign. The fact that he's dropped out, I think, reminds us of the way in which the deck is stacked in normal American politics against insurgent candidates who don't have the backing of the wealthy. And then on your second comment, Flossie, I'm going to disagree slightly. Yes, you guys may be tougher. And I don't know if you know this term, the generation that's been born this century and is in school now is sometimes referred to as snowflakes. They have no resiliency. And I do have to say, I've been surprised at how some of my most privileged students have been really unsettled by what's happened. And not because of the health consequences, I think because of an excess of sympathy of the suffering, for the suffering of people around them, but just because of the sheer experience of disruption. And so I do think that your generation, I hope my generation as well, has a little bit more resilience, and that the way in which we were raised gave rise to that. I don't think we have the antibodies to fight this virus. And so that's what I want to correct. I think that would be a mistaken impression. Yes, you were exposed to the Asian flu, etc. But that doesn't actually prepare your immune system to cope with a novel virus, a virus that's never been exposed to before. And the coronavirus is a novel virus, right? It crossed the species barrier and now it's here among us, but it's nothing that we have been exposed to before. And so our immune system is completely unprepared to handle it. If I understand the deaths, the medical etiology of the deaths, a lot of the deaths from coronavirus have to do with the patient's immune systems going haywire in trying to fight a disease that it has never been exposed to. All right, thank you, Flossie. Anybody else with a question or a comment at this point?
Can you hear me? I have a question.
Hi, Mary. Yes, I can.
Yeah, I'm thinking that with this virus, what we've discovered is that the world would be better off if many of us were somewhat less wealthy. If we traveled less, if we had fewer cars, if we stayed at home more, or just walked around the neighborhood and enjoyed what was going on with the birds singing and the flowers blooming, it seems like that's an opportunity that in many ways would equalize our income if we tax the rich substantially, and maybe just change our lives to simplify them just a little bit and equalize at the same time. Do you think there's a possibility of that happening?
Well, Marion, you're speaking to someone who's supposed to be flying back and forth to California every week right now, right?
Maybe we
and I
should keep doing this on Zoom rather than traveling each week.
Well, I was thinking maybe every other week once this is all done would be nice. Get to see you in person, get to see my family and friends in California who I'm missing right now. But so on the one hand, I think you may be right that some of our settled habits are going to be disrupted, and that in the period, and to be clear, I'm certainly hopeful that we are starting to, the phrase that's popular is flatten the curve, right? That the disease is not spreading as rapidly, that our public health infrastructure will begin to develop the capacity to handle the caseload that it's going to encounter, and that maybe a month from now, we will be somewhat less disrupted by all this. And that we can hope, we don't know, but we can hope that warmer weather will also make the transmission of the disease much less prevalent. But even if, in June or July, in some sense, we're able to go back to normal, I think we should anticipate that things will get bad again, or at least they could get bad again in November, December. That this will be cyclical for a while until there's an effective vaccine or more effective pharmacological interventions. But should we anticipate, if we're going in and out, normal, abnormal, the disease subsiding, the disease coming back, that when the periods when the disease subsides, we're just going to resume what it is we were doing before? And I think you're absolutely right, Marion, to say maybe that's not going to happen. I have a little pedometer, right? I keep track of how many steps I take. I'm taking 50% more steps. When I meet with my students now, it's on the phone. And when they call me, I put on my shoes and my coat and I slip out the door, right? And I walk around while I'm talking with them. I think once I get back to school, when the student comes to my office, I may start saying, let's take a walk. Wouldn't it be nice to have our conversation while also just, stretching our legs a little bit? And so, yes, I think there may be things that will be changed. But I think we also have to be careful in saying that what rendered us susceptible to this disease is something that we can change just by modifying our individual behavior. And yes, obviously, changing our behavior has radically diminished the transmission of the disease, and that's absolutely essential. But go back to the poor people who have less than $400 in savings, and so who can't stop going to work, right? It's not as if they can simply choose to stop going to work. They are structurally constrained. If they don't go to work, next week they're not going to eat, or they're not going to be able to cover other essential expenses. And they're, you're fortunate you're in a state that has put a hiatus on evictions. I'm in a state that hasn't, right? And so if you can't pay your rent, it may be that the courts will be gummed up for a while from all of this, and so you'll get a period of security, but eventually either you're going to have to pay that bill or you're going to have to find someplace else to live. And if you're really close to the margins, New York City has an awful lot of homeless people, right? And so when it comes to the degree to which we travel, some of that travel is leisure, some of that travel is voluntary, some of that travel is integral to the way in which the modern globalized economy works. And so I wonder whether we will start thinking not only about changing our behavior individually, but changing the way in which our lives are structured. And that takes collective action. That takes governmental agency to do it. And so that will be a more interesting political question. And to my mind, the most urgent question is, will we do something about the level of inequality that we've introduced? And we have become, as I'll make clear today or the next time we speak, much more unequal. And so coming back to Flossie's point, African Americans have always been unequal. Yes, African American inequality has changed. It's not static, but there's always been systematic inequality between whites and blacks in our society. But the overall level of income and wealth inequality has changed dramatically over the last, and I'm going to say 40 years, 1980 to 2020, in ways that I think make us much more vulnerable and much less unified and much more divided and precarious as a society, whether we're talking about the coronavirus or whether we're just talking about our social and political lives more generally. Anyone else with a question at this point? All right, so I'm going to move on. Was somebody trying to ask a question? No, okay. Then I'm going to go ahead and get us into the next topic. And I'm noticing that my PowerPoint did an automatic renumbering. So let me get the number correct. The second big point, inequalities of wealth and health in America before the Great Pandemic. And here I'm going to share a lot of information with you. And some of it will be information you're familiar with. But I've done some further research since the last time I've spoken with you about this topic. And so, as I say, this has become worse in the last 40 years. And so this diagram compares 1979 and 2006. And what it shows is the rise in income for quintiles, the 20 percentage groups, right? And that the poorest 20% did not get much richer at all over this period, where a 10% rise, whereas the richest 20%, minus the top 1%, got a fair bit richer, and the top 1% got astronomically richer over the same period, right? And so when you think about those differences compounding over years, what you see is that we are getting more and more unequal as a society. This is this diagram and the previous diagram are from Jacob Hacker and Paul Pearson's book, Winner Take All Politics. And they have this funny way of putting this. They say, essentially, if we had maintained the income distribution that we had in 1979 over the intervening years, as opposed to moving to a much more unequal income distribution, what would our society look like? And they suggest that the bottom fifth would be $5,000 a year richer. The next fifth, $10,000 a year richer. All the way up to the 90th percentile, all of us would get richer if we had just maintained the distribution of wealth from 1979. Whereas if you look at the top 5%, the top, the top 10% and the top 1%, those people would not be as rich, but right, those are the people who can most afford to not get wealthier. And one way to express this then is that in this period, right, the last 20-ish years, I guess it's 25 years, the average family, the bottom 90% of Americans transferred $110,000 to the richest 10% of Americans by changes in the distribution of income, changes in the tax structure in our society. I'm going to come at this a few different ways. This is the distribution of wage income. How many people earn how much? 46% of the American population earns less than $30,000 a year. These are the people who earn. These are not families. These are just wage earners, right? 20% earns between 30,000 and 50,000. 22% earns between 50,000 and 90,000. And so you add up those numbers, and what you see is that basically 90% of the population is earning $100,000 a year or less, and 50% of the population almost is earning $30,000 a year or less. And then if you look at who earns more than 100,000, so the top 10%, there's a very small share that's earning more than 250,000, and a very small share that's earning $1 million. Now, this is going to be a little tricky to unpack, but this is just a more graphic and more specific way of looking at this data. This is dividing us into a pie and looking how the pie is sliced. And what you see is that this big portion of the pie is people who earn $30,000 a year or less. So that's the nearly 50% of us. And 12% of Americans earn less than $5,000 a year. And remember, these are people who earn money. This is not this does not include, for instance, stay-at-home wives or husbands or the unemployed. This is just how much people earn who are earning. Another 7% earns less than $10,000 a year, right? And I'm not going to take you through all of this, but I think what you can see is it's one thing to say that 46% of us earn $30,000 a year or less, but when you begin to break it down, what you see is that about 25% of us earn less than $15,000 a year. And so if you want to understand, going back to that idea that basically 50% of us don't have $400 in savings for an emergency, think about how hard it would be to save $400 if you're earning less than $15,000 a year, as about 25% of Americans who earn are, right? And so this is not about being profligate, right? This is not about people being stupid in the way they spend their money. This is about the fact that people are not earning enough to save. They are living paycheck to paycheck. I'm just going to give you a little bit more data to give you a bit of a sense of where this is all about income inequality, right? I'm going to talk about wealth inequality next time we get together. And this is a diagram I know I've shared with you before. This takes it over a longer period. And what I like to say about this diagram is that it's important to see, if you look down in the 1965 to 1970 period, how tightly clustered, right? The green is the bottom 20%, the purple or blue, whatever that is the top 20%. And really, in the late 1960s, even the top 5%, we were all quite close together. And what's happened in the intervening years, and especially it begins to accelerate around 1980, and then kind of an exponential increase in inequality takes hold. And it's to the point now where look at the distance between the bottom 20% and the next 20% and the next 20%, right? Those are the people who are earning less than $15,000 a year, whereas the people who are in the middle quintile are earning $50,000 a year, right? But we have just a chasm of inequality in income that has opened up over the last roughly 50 years. And this is not fair. And I'm going to express this in a simple way to get at the degree of unfairness. This is rises in productivity, right? That's how well the economy is doing. The dark stripes indicate recessions, right? the gain in productivity from 2000 to 2015 is very similar in the gain in productivity from 1990 to 2000. But from 1990 to 2000, and if I went back further, you would actually see that this is the trend in post-war America. Productivity gains and income gains were tightly coupled with each other. They went together. Since around 2000, they've become completely uncoupled, which is to say, workers are more productive, but their productivity is not being rewarded with increased income. So if we break this down a little bit more, right, the top line is productivity, again, measured as per capita GDP. And then these are income figures, with the middle 40% having seen about a 30% rise in income, despite the fact that the GDP has risen 60%. And the bottom 50% seeing less than a 20% increase in income. And then if we add in the top 0.1%, right? You see how the scale of the diagram has to change entirely. They've got, a 400% increase in income, while the bottom 50% is down there at 20%, right? And so who is deriving the benefits of the increased productivity of the American economy? It's not the middle, it's not the bottom, it's the very top. And I've shared this with you before. This is just one more way of looking at this. When people think about their relative economic standing, they tend to look at people who are doing better than them, but perhaps not dramatically better than them. They look up, in other words. And so in 1967, if you were in the bottom 20%, looking up at the next 20%, you could see yourself as comparable. Whereas by the time we get to the current period, when you look up, I've made this joke with you before, you get a neck ache, because the difference between the groups in our society has become so steep, so extreme. We have become so unequal in our income gradient that we really are no longer comparable with each other. And it is painful, it is anxiety producing to compare yourself with those who are doing that much better than you. All right, so this is just to give you a little bit of a sense of the static inequality picture, right? And to just show you where we've got today. We're up to, right, the overview of income inequality in America, a snapshot of where we are now, and a little bit of the dynamics, how we got there. Not so much the causes, but just the way things have changed. I still want to talk about wealth, race, generation, geography, what the government and the unions are doing, and then bring in a global dimension. That was what I wanted to do with you today. And obviously I didn't get all the way there, but we've got, I guess, 4 topics left. That's where we can begin next week. But I do want to give you the opportunity again to discuss this, to ask questions. So I'll be quiet and let you share your comments, please. Who wants to start us out? And you can ask me to show a diagram again. And I know that, well, I'll be sending these to Anise, and maybe Anise and John will help to distribute them to you, so you'll be able to see them again after the lecture is done.
I have a question. Can you hear me?
I can. Who is this?
It's Doris.
Oh, hi, Doris. How are you?
I'm fine, thank you. Does the inequality that we have in the United States is that, is the pandemic worse by comparison to other industrial nations because of the inequality?
The pandemic is worse in the United States than it is in many other countries. Is that exclusively because of our inequality? I'm not going to say yes. I think that would be too simplistic an answer. I'll give you an example from Italy, right? The pandemic has been very bad in Italy in terms of the mortality rate. And I suggested to you that that's in part because of the Italian custom of intergenerational households, right? So children live with their parents until they get married. That unfortunately, the children contract the virus, don't get very sick, but then they give it to people in their family. And sometimes in an Italian household, you've got 3 or even 4 generations living under the same roof, right? And so it increases the transmission to people who are more susceptible to the disease. Are Italians living in multi-generational households because their society is more unequal? I don't think so. I mean, there are aspects, but I think the main cause has to do with the custom, right? With a way of life that's long established and deeply ingrained. And so that's not exclusively about inequality. So in the United States, right, I think a large portion of the story, as I emphasized for those of you who listened last week, has to do with the slow, inadequate, at points incompetent response of our federal government and its leadership. And again, that doesn't have to do with our inequality per se, although there's a story to be told about inequality contributing to the election of Donald Trump, that if we were a more equal society, perhaps we would have a different president. But that's a pretty indirect way of connecting inequality. But if we were more equal, would we be more solidaristic? Would that lead us perhaps to support a stronger governmental role in securing the wages of workers who are already precarious, as we see in many European societies? And my suspicion is that the answer to that question is yes, and that fewer people would therefore be in the position of having to work in order to make ends meet. And therefore, for instance, the racial disparity that we see in susceptibility to the disease would not be there. And perhaps we could more rationally decide, who do we really need to be working? And can we equip those people to protect them, put them in working conditions that allow them to work without bearing the risks that many workers are bearing right now? And so, yes, my suggestion to you is it's worse in America because we're more unequal, but no, it's not exclusively because we're more unequal. There are many factors, some of them having to do with our federal system of government, some of them having to do with who's in charge of that system of government. So it's a complicated story that we clearly don't fully understand right now, right? We're in the midst of this. Probably 20 years from now, we'll have a much better perspective on what actually happened than we can possibly have right now. Thank you, Doris. Did that answer your question?
Kind of. Well, I guess there's, what about the comparison with the Asian countries who have, it seems as though they've been able to manage better. Is that due to income inequality and the family system, or what's the situation there?
And so I'd have to pull apart different Asian countries, right? So if I were talking about China, I'd have to say, first of all, we're not clear that we should be trusting the data. So how well did China manage that in part depends on understanding whether or not they systematically underestimated the numbers and the fatalities. That may very well be. But then it's also the case that China is an authoritarian society, and an authoritarian society has capacities, power that a democratic society doesn't have. And so there we're kind of comparing apples and oranges. But if we're talking about South Korea, there I think or Taiwan, right, we're talking about democratic societies, at least much more democratic societies. And we're talking about societies that perhaps have more efficient national bureaucracies, better healthcare systems. And again, it's a little tricky to pull this stuff apart, right? If you are going to provide national healthcare, you need a stronger government to do that. If you're going to have higher tax rates on the wealthy, that funds government in a way that our regressive tax structure in the United States doesn't, right? And so, yes, I would say if we're talking about Korea or Taiwan, for instance, that it's entirely possible that the inequality would be one aspect of the explanation. But I want to avoid the simple version of that story, which is because you're more equal, you're better at handling the disease. I think you got to add perhaps part of the reason that you're more equal is because your government is more powerful, or that the steps you take to make your society more equal means that your government is better funded, or the cultural effect of your society being more equal is that there's greater solidarity and more cooperation, less competition in your society, and societies that are better at cooperating are better at managing catastrophes than societies where we're all out there fighting for our individual toilet paper, right? And so, yes, but we have to be careful of making the story too simple.
Well, I'm just hoping that because of what we've just experienced and what we're experiencing now, that on the platform for our government forging ahead for 2020, that we will get universal health care of some sort, right? Won't this help it? Won't this help that platform?
I don't know. I don't know. I don't want to say absolutely not, but I also, again, don't want to say absolutely yes. I'm sorry to equivocate like this, but I think you got to remember, and I spoke a little bit about this last week, that for some people looking at the Trump administration reaction to this, what this exposes is the utter incompetence of the effort to manage this, right? And so the expectation is that Trump will collapse in popularity and be deeply damaged in his re-election campaign. But for other people, perhaps their response is seen more through the lens of authority. In a moment of genuine national crisis, we need a strong leader, and that Donald Trump is a stronger leader than Joe Biden, and that depending upon which of those views you take, your view of his management of the crisis may be very different. Does the failure of the American healthcare system to cope adequately with the coronavirus suggest to us that we should change our healthcare system? Probably, for many of us. Does it suggest to us that we need universal healthcare, a public option, Medicare for all? I suspect that those opinions are going to divide very sharply in terms of whether you already favored that policy. If you already favored that policy, then this is a strong argument in favor of it. Whereas if you didn't, then I'm not sure this is going to persuade you. Let me say just one more thing about this, which is I do anticipate that we're going to see serious strains on the American healthcare system, not only due to the fact that we are going to be battling a recurrent pandemic for a year or a year and a half, and that's going to increase healthcare costs and strain the infrastructure of the medical system, but also because the majority of Americans still get their healthcare insurance through private insurance provided by their employers. And we're seeing the largest jump in unemployment since the Great Depression. I mean, the figures are stunning. 6 million people filing for unemployment in a couple weeks. It's staggering. And among other things, that means that many of those people are probably losing their health insurance right now. And so I think we should expect premiums are going to go way up for private health insurance, as well as for Obamacare or Affordable Care Act health insurance. We should expect that the expenses on Medicare and Medicaid are going to go up as a result, but that just more and more Americans are also going to fall through the cracks of our very porous safety net. And so, yes, I do think the healthcare system is going to face a crisis as a result of this. Will the reaction to that crisis be, we need universal healthcare? I share your hope. Just as somebody who studies politics from a, supposedly dispassionate, objective perspective, I'm not confident that that's going to be the outcome. I think it will depend in part on Joe Biden. I think it'll depend in part on whether or not the Democrats manage to retake the Senate. And it will depend in part on whether or not there's something of a culture shift in our society. As long as a significant portion of Americans don't favor public health care, as long as one of our two major parties continues to gain support by opposing it, I think it's unlikely that it's going to pass. I'm sorry to say. Anyone else with a question?
I need to unmute.
No,
David, this is Matt Mitchell.
Hi, Matt.
I just have a comment. We're talking about something here that's happened fairly rapidly and really has got our attention with the virus. But there's a continuity here of different problems that we're facing. Some of them unfold over centuries. That's climate. Inequality, that's over decades, as you've just demonstrated. We get the virus, and that unfolds over months. And if we have a major earthquake, that's just going to put everything aside. That happens in an instant. It seems to me that the most immediate stuff is what puts the rest of the stuff into the shade.
Say the last little bit again, Matt. The most immediate stuff.
The most immediate stuff just pushes aside all of the longer term problems that we know we have and really aren't addressing.
So I'm not sure about that, Matt. So does it push aside or does it crystallize them and catalyze our attention on them? And so, the Great Depression came on us very rapidly. And it was produced by the long-term economic forces that gave rise to the Gilded Age and that had generated a long series of sharp economic declines in the 19th century. But in the middle of the 20th century or the first third of the 20th century, it led to new policy, right, that fundamentally reshaped the social compact, that gave organized labor much more power and much more of a foothold in American politics, that expanded the rights and entitlements of Americans, that started to generate a sense, you know, in FDR's rhetoric of there being a kind of set of social rights in addition to there being political and civil rights. And so I'm not sure I would say that the suddenness of the Great Depression led us to neglect everything that had come before so much as it helped us to see that we needed to change the way in which we were managing the long-term dynamics of an emerging industrial capitalist economy. And so I think going back to Doris's comment, right, you know, we can hope that this crisis, though it's sudden, though it's a natural disaster, and though it really is not directly and obviously caused by the long-term social dynamics that we're dealing with when we talk about wealth and income inequality, nevertheless leads us to think anew about these problems, and leads us to demand a new social compact, a new set of responsibilities for our government. One of the things that I was talking about in the previous lecture is this idea that we live in a risk society and that there's been a risk shift, that over the last 50, 60 years, two things have happened simultaneously. The first is that our capacity to be influenced by things that happen thousands of miles, tens of thousands of miles away from us has gone up exponentially, right? There can be a meltdown in a reactor in Chernobyl and all of Europe is affected by it, right? And the technology that we have has made us much more interconnected and much more vulnerable to something in one society affecting those in a completely separate society. So that's this idea that we live in a risk society. The risks are hard to anticipate. They come from far away. Virus that breaks out in a market in Wuhan, China, is now affecting the rest of the world just months later, right? And at the same time, there's been a risk shift. The government has shedded its responsibility for protecting us from these risks, essentially said to each of us, you're on your own. And maybe this will be the straw that breaks the camel back, right? We say, we don't want to have to manage our own risks. The reason we have government, the reason we pay taxes is to have collective agency to protect ourselves in situations like this. It might produce a culture change. I'm not saying that it will, but I'm also saying I'm not as confident as you are, Matt, that we're going to be overwhelmed and distracted by this, as opposed to perhaps it catalyzing changes in our politics. Do you want to come back at me, Matt? All right. So I have to say that I've got a Zoom Seder dinner starting in about an hour and a half, and I've got to get some preparation done between now and then. I'm not hearing any more questions. Thank you. This is always a delight in person. I'm discovering that it's also not, well, it's fun in this venue as well. I hope we can keep involving more people, and I hope we can keep doing it. I look forward to seeing you guys next Saturday. Please keep taking good care of yourself and be safe.
Thank you.
Thank you, David.
Thank you, David.
Thank you.
David.
Yes. Take care.
Thanks, everybody. Take care. Bye-bye.
Thank you.
Bye.
There she is.
Yes.
Anise, do we need to talk about anything? We can handle that via email, right?
Yeah, sure. Yeah, I can, email.
Okay, and
All
I'll
right.
get you a copy of the slides, okay?
All right. Sounds good.
All right. Take care, everybody. Bye-bye.
All right. Take care.
It's my daddy.